I send my patients here because Dr. Dunas, Dr. Pittman, and Dr. Abusi are just fantastic clinicians. And I've had, every time I send a patient down, they come back to me and just say how great the practice was, how awesome of an experience they had. And myself, I come down here and talk to the doctors quite often about our patients. And as soon as you walk into the office, you can just tell that it's a special office. As a clinician, I actually aspire for my office to be like this office. As soon as I walk in, everyone's so friendly. Dr. Shirk, how are you? They know who you are. They know what patients we're sending down. Correspondence has been fantastic. They're just on top of their game. Sarah at the front desk, whenever we call down, I like to give her a hard time when I call, but when we do call down, Sarah knows instantly, oh, you sent down patient so-and-so, and she knows right away what we sent them down for, what procedures were completed here, if there's any future correspondence, and they always follow up after they're seen down here. As a practice owner, I take great pride in how I treat my patients, so I take it as a reflection of myself on who I refer to and what offices we use. When I send to Synergy, I know that my patients are going to get good care. I know that they're going to get the best care possible anywhere. I mean, the clinicians here and the team are just top-notch, fantastic. The doctors do research themselves. Not only do they stay up to date with the latest research, they are the doctors that are doing this research. So that's impressive to me. You know, I like to see doctors staying up to date with the latest techniques and knowledge out there, and all the doctors and team members here do that. The doctors are very approachable. As specialists, sometimes there is a little bit of a divide between the referring doctor and the specialist themselves, and sometimes the communication channels aren't quite as fluid as I would like them to be. But I come down here and see patients with the doctors come up and see patients at our office occasionally, and I feel very welcome when I come down. They always have everything ready for me. I just walk in and we're ready to go. And we have had quite a few patients that when we're doing some multidisciplinary, what might be general dentistry combined with periodontics and orthodontics, where the three doctors would get together and talk. And this is stuff we do like outside the office. It's not during patient days when we're working. We take our free time and sit down and we might bounce ideas off. And Dr. Dunas is always, well, hey, did you think about this? Did you think about this? Let's call the orthodontist and see what they think on this. And it's not just one size fits all. We really do take great care to get a lot of input and a lot of opinions on cases. And Dr. Dunas in particular, who I've worked with the most, is always very receptive, and I've learned a lot from him.